Hello everyone, I am Dr. Akshay Hari, consultant neurosurgeon and spine surgeon working at Aster CMI Hospital, Hebbal, Bangalore. Today I am going to be talking to you about non-surgical approaches for the treatment of scoliosis. So we all know that scoliosis is an abnormal curvature of the spine that affects millions globally. While most cases may not be very severe, the treatment is usually non-surgical in most of the milder curves. Now, the Scoliosis Research Society has defined scoliosis as any abnormal sideward curvature of the spine more than 10 degrees. So anything less than 10 degrees is usually considered normal. Mild curves are those ranging between 10 to 15 degrees. It is these kind of curves that usually do not require any form of surgical intervention. So a curve which is mild can easily be managed with non-surgical methods. So these non-surgical methods usually are aimed at preventing the progression of the disease and also to try and control the condition. Like I said, scoliosis is a progressive disease, and if detected early and intervened early, the progression may be arrested. So the non-surgical treatment methods are usually in the form of observation, physical therapy, and bracing. So if you suspect scoliosis in your child, the first thing would be to take the child to the spine specialist. And if the degree of curvature is somewhere between 10 to 15 degrees, the doctor will usually recommend observation. Now, what does observation mean? During this observation, the progression of the curve is usually monitored. It is in the form of serial follow-ups using specialized medical checkups, as well as X-rays are usually done at serial intervals ranging from 6 months to 1 year intervals, wherein the curve progression is monitored. At this point, if the progression of curve is documented, the next stage of treatment would then be initiated. Coming to bracing. Now, for those curves which are moderate, ranging from 20 to 40 degrees, or if there is a rapid progression of the curve during the monitoring phase, more than 5 degrees, then the bracing is another alternative which can be utilized. So what happens in bracing? So a brace is basically a customized device which can be fitted onto the child's body, which can help prevent the progression of the disease. Sometimes it can also help in maintaining spinal alignment. Studies have shown that the longer a brace is worn, the more effective it is. Research has shown that if a brace is worn at least 16 to 18 hours a day, it is more effective in preventing the progression of scoliosis. Nowadays, there are also nighttime braces which have been recently developed, where the brace can be worn only at night, but the efficacy of these are yet to be fully documented. There are also different types of braces which have been described. The earlier ones, conventional ones, used to be quite rigid and are difficult to be worn, especially for long durations. In countries such as India, where the temperature is quite hot and humid, wearing rigid braces for long periods of time has itself got their own complications. So nowadays, semi-rigid and more flexible type of braces have also been described. These kind of braces are more user-friendly, and the patient compliance is also improved so that the brace can be worn for a longer period. So what exactly does the brace do? Does it really correct the spine and make it straight? Not really. The whole idea of wearing the brace is to prevent progression. What the brace actually does is that if it is properly worn, the progression of the disease may be arrested or may be slowed down, so that once the child reaches skeletal maturity or the spine is fully developed, the brace can then be removed. At that point of time, the scoliotic curvature will return back to what it originally was, which can be acceptable. Another alternative method is physiotherapy or yoga. While these are more of adjuncts and not aimed at preventing progression of scoliosis entirely on their own, what they do is, by the form of exercises such as strengthening and stretches, the spine can be made more flexible and postural correction can be achieved by strengthening the core muscles. Sometimes pain, if it is associated with scoliosis, may also be alleviated with the help of physiotherapy. However, finally, despite all these non-surgical methods such as bracing and physiotherapy, some curves do progress to larger extents. In such cases, it may be necessary, such as the curve progressing more than 40 to 50 degrees, in order to prevent further complications associated with severe scoliosis, surgery may be recommended. Now, surgery, if it is advised in such cases, can also be done safely with minimal complications. The main surgical options in such cases would be number 1, permanent definitive deformity correction surgery, wherein screws and rods and metal implants are utilized to correct the deformity. The other option, if the child is quite young or the spine is not completely developed, is what is called as growing rods. In this system, screws and rods are implanted into the spine, and then these are expanded during the phase of growth of the child so that the curve can ultimately be corrected as long as the child is growing. Ultimately, the entire process of management of scoliosis is very individualized, and it is very essential to choose between surgery or non-surgery. This can only be done with the assistance of an experienced spine specialist. So if you have scoliosis or if you have detected scoliosis in your child, please do consult an experienced spine surgeon who can then guide you and give you an individualized treatment plan for achieving best results. Thank you.